the most impactful work that I'm doing has to do with my work with families and work that ARNet has been my major funder for, and has kind of seen the potential in this because this work can be really hard to fund. I'm partnering with survivors of cardiac arrest and family members to both design the program of research, complete the research, report it, publish it, make changes to the healthcare system. Cardiac arrest is a condition that occurs every 12 minutes in Canada for someone outside of hospital. About 35 to 36,000 occur per year, solely of cardiac origin. We're putting all this time and effort and energy into just trying to get into the minutiae of this medication or that medication, or how can we attenuate defibrillation to correct irregular heart rhythms properly. At the whole time we've lost perspective on the suffering that goes on around cardiac arrest. Because depending upon the setting, only 10% of people survive out of hospital cardiac arrest. Maybe in hospital, maybe only 30% survive. And when follow-up work is done with families, often that grief prolongs in prolonged depression, anxiety disorders, the inability to go back to work, relapse into addiction, self-harm, suicide. There's all these sort of sequelae, these outcomes that occur from this really, hurtful process. And these are the sorts of emotions that my co-researchers, the folks that I'm doing this work, describe. They feel excluded, sometimes they feel mistreated. So this program of research that's supported by ARNet is all around making cardiac arrest care more family-centered. But we're simultaneously being absolutely focused on improving the healthcare system around patients. And that's what makes this kind of research unique. I train people who've survived cardiac arrest or their family members to participate in knowledge synthesis. This is like an academic output, a scoping review of the literature. But these family members and survivors, they sort through the literature. They help identify what's important and what changes should be made to the healthcare systems. Yes, focus on the family member in cardiac arrest because survival is paramount. Yes, do that. But there are still opportunities to collaborate between healthcare professionals and families. Support families to be present during cardiac arrest if they want to be there with their loved one.